Hi, my name is Qasim. I'm one of the doctors here at the London's Aesthetic Regenerative Centre here at Harley Street. Today we have our lovely patient with us and we'll be talking over a treatment called Profhilo. So this treatment is fantastic in terms of what it can deliver for results. It can help with moisturization of the skin. It's essentially not the same as a dermal filler but slightly thinner, and it helps rejuvenate the skin, helps slightly lift the skin as well, and just kind of improves the overall appearance of the skin too. As you can see here on the patient, we have a few spots on either side, so we have a total of 5 points we've inject here. We put local anaesthetic on, and the idea is to inject 1 mil on either side of the face, and hopefully afterwards it will all disperse out, kind of regenerate the skin, help it look a lot more healthy, a lot more toned, a lot more fixed, and we'll see the results after that.
Qasim, you had the patient with you with the Profhilo treatment. What was it the patient was actually looking for? Why was it that we did the Profhilo on that patient?
The patient was essentially looking for some kind of global rehydration of the skin, just some revitalization of the skin, and just a much better overall appearance.
Good. I think that was a good choice to do because Profhilo, and I've been using Profhilo for I think now, gosh, Qasim, 7 years. What Profhilo does is it's one of these fillers that moves around and not many wherever it's required, and nowadays there's known as skin boosters, so there's lots of other alternatives as well as Profhilo. There's about 4 or 5 other products that can be used, but in essence what skin boosters are doing is they are going in at set points and they are moving around and they're giving a generalized hydration and volumization. So you're not getting lumps, it's just going around spreading whatever it's needed, it's lifting it up, it's giving it that volume, it's giving that fresh, appearance, it's taking the tiredness away. And in Profhilo, because this is what this particular patient had, there are 5 injection points, which are the BPS points, which have been trained, which is in the mid cheek, anterior to the tragus, angle of the mandible, at the chin area, and also round about the cheek area. But just through my own experience, and I think I've shared that with you, Qasim, was that sometimes patients' faces are different. And we have to vary the injection point ever so slightly depending on what the patient's looking for. In this particular patient that you treated, was there anything that you did that was slightly different from what the standard sort of things is to personalize it for that patient?
Absolutely, and I think with every patient you need to tailor it to what's going to suit them best according to what their expectations are and what's going to get the best result. For this patient that was here, she had some hollowness around the temple area, and the best thing as guided by yourself is that we actually kind of made a more superior injection point on the lateral aspect of the face, such that, as you say, that lovely solution can just diffuse out into here and kind of revolumize this area.
Yeah, and at the same time covering the hollowness under the eyes, etc. Yeah.
Yes.
Well done, and that's what she was needing. So I think she went away. She's coming back in a month's time for our second treatment. And Profhilo normally takes 2 treatments a month apart, and the results are normally apparent about a month after the second treatment. It's something that's recommended that you do once every 6 months. Absolutely fine. A lovely global rehydration to be done. So a great way of managing just generalized overall skin hydration, skin tightening, giving a younger and a fresher look, etc. As if something's not been done. It's a face that they recognize. You go, oh my gosh, I saw this 5 years ago in the mirror. And that's what it is. But the key points are, do personalize it to the individual, and that's what people don't realize. I think just going in at set points is not what it's about. It's tailoring the treatment for the individual. But that was an amazing treatment you did earlier on. Thanks very much for that, Qasim.
No problem. Thank you.
Thank you.